Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Let me first thank Shri Ram Madhav ji and Major General Kathoch of the India Foundation for giving me this privilege of being with most distinguished excellencies, ambassadors of various nations of the world. I had the privilege of meeting many of you at number of occasions in my ministry and at number of other functions also, because I can recognize many of the faces that I see on the screen now. So it's a matter of privilege that way, but unfortunately we are meeting at a time when we all, in fact the whole of humanity, the whole of the world is facing an unprecedented crisis. A small virus has become so important that the whole world is disturbed. Every day in the morning I start my day with prayers to the God, the Almighty, for not only the health of Indians, but for every human being across the globe. I know that for the last over 3 months now, the whole world is struggling very hard to combat the attack of the virus. Everybody has been putting their heart and soul into this fight. We are using all our might, all the backing of science, technology, epidemiology, and the knowledge and experience gained by us over the years and over the decades for fighting all these new viruses and bacteria. Fortunately, our record in the past has not been bad. We all know that this world together could defeat once for all the smallpox virus. And today this whole world is a place where one disease has been thoroughly eradicated in the 70s. Similarly, we had millions of children all across the globe who, because of the attack of the poliomyelitis virus, used to get handicapped, and their parents used to suffer all their life. And the whole world together started fighting this virus when we had a resolution in the World Health Assembly in 1988 to eradicate poliomyelitis also. I was fortunate to have the blessings of God in 1993 to be blessed with a dream to work for a polio-free India. And during the last 25 years, I had a lot of opportunity to work for polio-free India and a polio-free Southeast Asia also through the World Health Organization. We all know that living apart only a very few countries, the whole world is now also polio-free, and very soon, in the next few years, we will have certification from WHO for the whole world also. So when we work together, when we put forward our combined might, we can win over a virus also. Smallpox and poliomyelitis are examples of a fight like this. I am very hopeful that in spite of the fact that we have had a lot of people who lost their lives in COVID-19, hundreds and thousands, and right now at least over 1 million have got affected by the virus. But the good thing is that 80% of the people recover quite well. The mortality is not too high, but for a family who loses one person because of a disease, for them the mortality rate is 100%. So that gives all of us enough grief. We know that we have had some of the great important personalities all over the world who also got unfortunately infected with the virus. So we all start our day with prayers for at least be able to encounter its virulence for the time being. As far as India is concerned, let me apprise all of you, since all of you live in Delhi itself, you, I know, must be following everything right from the beginning, and not much that I will share with you for you. But even then, I would like to briefly summarize that in India, when China had informed the World Health Organization about the new coronavirus on 7th of January, we in India and in our health ministry had in fact organized a meeting of all our experts, including people from WHO, where we discussed the probable things that could happen not only to India but to the whole world. And in the next couple of days, we started imagining and also started our health preparedness for the whole nation. Next week, on 17th of January, we issued detailed health preparedness guidelines to all the states in the country. We started our community health surveillance activities all over the country. We also issued detailed travel advisories to passengers traveling by air. And the very next day, on 18th of January, we started screening all our international passengers coming from China and Hong Kong, etc. at 7 major airports. This process, which we started on 18th January, ultimately in March, from time to time we kept improving our advisories, kept involving more airports, and in March, ultimately we decided, when we were in fact screening all the 30 international airports, that we will not allow any international flight or international passenger to enter India. That's a long story of those 2 months, but I will not like to get into the details of that. You are all familiar with that. Similarly, at the national level, starting from the Prime Minister to the Cabinet Secretary to the Health Minister, who headed a group of ministers formed by the Prime Minister with other ministers, all related ministers, the Health Secretary, we started monitoring everything in the country at the national level, and ensured that almost every day we were talking to the state health minister, the state health officials. All this continued because we had our first case towards the end of January. That was probably, I think, on 1st of Feb. All these months we were acting proactively and well in advance after anticipating it happen. Fortunately, we had also the experience of many other countries which were at the peak of their trouble during those periods. Right now, I can tell you that in India, the present situation is such that in about over 400 districts of the country, we do not have any COVID-19 case. And there are 133 districts which we have called as hotspots, where we have cases of COVID-19 in different numbers. That also we have divided into two categories, where there are more than 15 cases or where there are less than 15 cases. And we are already having an effective containment strategies for these clusters and these districts where all these cases have occurred. I may inform you that right from the very beginning, you see, the fight against polio and other viruses helped India to develop a very robust integrated disease surveillance program for the whole country. Even today, almost 7 lakh people, mostly passengers who traveled to India during the last few months, they are all under community surveillance. Our surveillance officers and rapid response teams in the field all over the country are keeping a watch on them, keeping in touch with them, advising them on day-to-day basis. Similarly, when we banned all the international flights in the last 3 days, that was on 21st and 22nd and 23rd of March, we had 64,000 passengers, Indians and others, who came back to India. All these 64,000 passengers, about 56,000 of them were advised to be in home quarantine, and 8,000 of them were kept in institutional quarantine. As I had mentioned earlier, we screened almost every passenger at different times according to our advisories, starting from 18th January. And till the time we banned all the flights, we had screened passengers from over 15,000 flights in the country and screened over 1.5 million people. Similarly, we had also screened people at all our seaports, a dozen of them being major seaports and about 65 of them being non-major seaports. There also we screened about 47,000 passengers. Also, when we had the first report of a first case in Nepal, we started screening all our borders with Nepal in all the neighboring states, and there also we screened more than 2 million people crossing the borders, and also organized over 5,000 gram sabhas in the neighboring villages of those borders. In fact, all through we ensured that whatever is possible, it must be done. During the course of these last 2 months, we ensured that we have adequate testing facilities in the country for coronavirus. We started with our one lab, which is the basic lab in Pune, that is the National Institute of Virology. And today we have developed a network of over 200 labs all over the country which are having the ability to test the coronavirus. Over 150 of them are public labs supported by the government, and the rest of them are also the nationally NABL accredited labs with 16,000 collection centers all over the country. We have tested over 1,30,000 people who had symptoms, and there is a well-defined, scientifically validated by experts criteria of who needs to be tested, who are being tested at all these laboratories all over the country. We have also made adequate preparations for the capacity building. We started with training of all possible staff, whether it was the airlines staff, whether it was the airlines crew, whether it was the immigration officials, airport people, surveillance officers, rapid response teams, disaster management teams, our grassroots health workers. We did a massive, robust training of all the people all over the country through all possible means, and ensured that everybody it's not only the medical professionals, but everybody else is well prepared to handle the crisis. Even now, when we have the least number of affected cases in the whole world, that is about 3.4 patients per million population, we have still made adequate preparations. I am pretty confident that we will not face the crisis of that unprecedented nature in the future. But God forbid, if something severe and extremely unfortunate happens in India, we have made our preparations for the worst also. Over 500 exclusively dedicated hospitals for COVID, over 2 lakh beds exclusively dedicated right now for COVID in other hospitals. Preparations in the private sector also, over 50,000 ICU beds, exclusively dedicated ventilators, and also we have ordered for everything in plenty for future times, whether it is the PPEs, whether it is the N95 masks, or whether it is the ventilators. You all know that the Prime Minister has been leading from the front. He has been monitoring everything, and he gave a call to the nation for a Janta curfew on 22nd of March, which was extremely successful. We followed it up with a lockdown. And today we are in the third week of the lockdown. There is significantly successful support to the lockdown. Our scientists in the Science and Technology Ministry, CSIR, and also biotechnology. These are the departments which I head apart from health. They have also started working on vaccines, and the new startups are being encouraged to find out the solutions for COVID-19 in different forms. India is one of the countries which has isolated the virus, and we are part of the WHO Solidarity Trial. I am in touch with the regional office of WHO almost regularly, and also with the WHO headquarters. In the last couple of days, I participated in video conferences with health ministers of the whole world, and of course also the Southeast Asia and Asian region with the help of the World Health Organization. Till the time the whole world is able to find out a vaccine which is going to help all of us individually, we don't know how much time it will take. Although there are 40 candidates working on it, but only 2 have reached the very early stages of clinical trial. But we are wishing that very soon the world should have a vaccine for COVID-19. But I have been saying it time and again that for the whole world, right now, social distancing and probably the lockdown, these two together remain the most potent social vaccines, and the whole world has to continuously propagate the value of these together. And if the importance of social distancing comes from top leaders, it is elaborated, it is talked about by people all over the world. They are already doing it. But I think that's the only way right now to save the people of the whole world. Our Prime Minister has been in touch with most of the global leaders. He organized a meeting of the SAARC nations. He initiated efforts to create a SAARC emergency COVID fund and started by contributing for that fund also. We have taken all possible measures. We know in all this lockdown, many patients were likely to suffer. So we have in the recent past institutionalized mechanisms for promoting telemedicine in a big way, for promoting digital prescriptions, for looking after the mental health of the people, for ensuring that all the doctors who are treating COVID patients in the whole country, they have access to advice from the very able specialists at the All India Institute of Medical Sciences. So we have a telecontact system, and we are ensuring that even the poorest of the poor, the migrant people and those who are likely to suffer, the Prime Minister with the help of the Finance Ministry has already declared a huge package of 1.7 million In fact, 1,70,000 crores for the poorest of the poor. Even for the health sector, he has declared a huge 15,000 crores package to ensure that we strengthen our total network. We have been using all possible means to communicate to the people of India, all our risk communication strategies through helplines where lakhs of people visit, through the caller tune in the telephones, which all of you must have heard, to ensure that even the most illiterate, they are educated about the basic precautions that they need to tell. Our website in the health ministry is very thoroughly and very comprehensively backed with all possible information for all sections of the society, including experts, with all guidelines. And right now it is being visited by over 22 crore people in the country, trying to fight out the challenge of wrong communication or fake news, etc., which are also to some extent spoiling the atmosphere for handling COVID in a positive manner, not only in India, but for the whole country. I think I can continue to talk about what we have been able to do. There are lots of details about that, but I feel happy in informing our ambassadors that we were able to bring back over 2,500 people from China, Japan, Italy and Iran during the peak of the crisis. And there also we brought back 48 foreign nationals also. In the initial stages, we know that some 14, 15, our dear Italians got the illness in Agra. We immediately brought them to Delhi and we got them admitted to one of our prime hospitals, Vedanta in New Delhi, where they were being treated by the best physicians. I used to talk to the doctors almost every second day, and on Holi, I spoke to some of them on the video call also. 13 out of them got discharged after having been taken care of. Unfortunately, we lost one very senior, very old patient for whom the doctors tried a lot with all possible aid and support systems. Whatever best we could do, we have been able to do, we are doing, and we look forward to continuous sharing of experience, support, whatever support we were able to extend to the other countries in whatever form it was asked for. We have tried to extend that, including the recent issue about some of the drugs and pharmaceuticals. So I would use this moment to thank all the countries all across the globe. Through you, Honorable Excellencies, and I want to convey the good wishes of all Indians, for all people all across the world, we wish that everyone should come out of this crisis as soon as possible, and we pray for the peace of the souls of all those people who left for heavenly abode because of Covid-19. I think I would like to stop here because I know the limitations of time. Maybe I have taken much more than what was expected of me. I look forward to your suggestions and your blessings on this occasion. Thank you so much.
Thank you, Honorable Minister. We have over 50 diplomats and officials from the international agencies in this session. With your permission, we will take a few questions. Friends, you have to use the menu bar at the bottom. Click on participants. Then you will get an option raise a hand. You have to click on the raise a hand button so that we will call you to ask the question. I have Ambassador Fredrickson waiting to ask the questions. Ambassador, you can unmute yourself and ask the question.
Thank you very much. I'm the Danish ambassador, and may I first and foremost congratulate you on how far you have come. One question remains, Honorable Minister. When do you see the peak here in India? Have you really managed to flatten out the curve, or what can we expect? Thank you very much.
You see, as far as, although I am a doctor but not an epidemiologist, but I keep in touch with all the experts and the epidemiologists. Usually the experts say that when you use ultimate interventions like lockdown and all, it normally takes 2 to 4 weeks for the curve to flatten out. So right now, as I said, we have 3.4 cases per million of population. Not a very, very big number, and it is the lowest number in the whole world. Not a very big number for a country as vast as India. But now in the third week of our lockdown, I expect that in the coming days or weeks, we expect better results, and we are hoping that India should be able to come out of this crisis with minimal damage to human beings and in fact loss of lives.
Thank you. I request diplomats to kindly self-introduce before asking the question. Ambassador Federico.
Thank you very much. And congratulations, Mr. Minister. I think that we have all been following very closely what India has been doing. Countries like my own from Mexico are also struggling to take the appropriate measures before the disease gets out of control. We're watching very closely what you have been doing and how successful it is here. I want to ask you something that's very specific and very very concrete. We've had, as you know, and I think Mexico and many other embassies here have been trying to deal with a number of our nationals who are stranded throughout India, who are here for tourist or academic purposes or whatever. And in many cases, we have been trying to relocate them to more appropriate facilities or closer to cities such as Delhi and Mumbai, because that's where the airports have been working, the flights have been taking out, so that we can take some of these people and bring them back home. One of the issues, one of the problems that we have faced in many instances, Mr. Minister, is that hotels or other hostels and such are requiring people to have a certificate of health. before they can be accepted as guests of these premises. And we have been trying to sort out whether this is a requirement that the Ministry of Health has established, whether this is something that is legal under the circumstances, and whether it's a doable premise, because it's almost impossible for someone, a foreigner, trying to get a lodging in a hotel to have a certificate of health. Sometimes they've been asked to have a certificate saying that they do not have COVID-19. And we know how these testings are only done in certain circumstances, not when somebody's trying just to get a room in a hotel. So I was wondering if you could comment on that, Mr. Minister. Thank you very much.
Well, I could what I could understand was the two parts of your question. One was about your concern for all the foreign nationals who are unfortunately stranded. They came to India for tourism purpose or for any other reason, but because of the lockdown and of course the ban on all these flights, whether inside the country or outside the country, they are all stranded. Even a lot of Indians are also stranded who in fact wanted to go back. I can very strongly appreciate your concern. We are quite well aware of this concern, but right now under the present circumstances it may be difficult for me to really be able to comment about that, but I can only say that at the earliest possible opportune moment, the country will be thoroughly sympathetic to their concerns and see what best could be done ultimately to look after these concerns also without compromising with the health of the people overall at large. Regarding the second point that you mentioned about some hotels being asking people about these certificates, etc. So I would suggest that if we get some, because as far as I know, there is nothing like this which has been given as any of those advisories. No doubt. Everybody who has been advised to be in quarantine, he has to be in quarantine, he has to follow the rules of the quarantine, and this is the advice of the government also. The government is monitoring that part quite well. And similarly, those who are symptomatic or contacts, etc., there is a well-defined guideline about who needs to be tested. But if some particular hotels are in fact embarrassing or in some way harassing, if we get some specific informations about such incidents wherever they are happening with a bit of details, I can promise that I'll personally look into it, and if there is a need for further advisories to the governments in this particular direction, which may clear any confusion if at all it remains in the system, we'll certainly get it rectified. But I would love to have details. So through our, if you could send them to our External Affairs Ministry or directly to my ministry, I will together look at it and see that such things can be taken care of.
Thank you. Pastor Vardhan.
Thank you for organizing this conference. Secondly, I would like to express my sincere appreciation and solidarity to you personally, to your team, and to the whole government and people of India in fighting COVID-19. Now let me ask my question. As it is well known, India is among the biggest drug exporters in the world, a list of 10 countries. And as we know, recently the government has reconsidered its ban policy on some drugs. We understand the concerns of your government that first and foremost the needs of the local population should be addressed, and we are very happy that the policy is being reconsidered. And now some drugs will be available also to the international community and to some other countries. My question, the distribution worldwide, international distribution, is going to be based on free market, commercial, or sort of forced principles, or some other criteria also will be applied in consideration of our inquiries and requests? I thank you, Mr. Minister.
I can only say that right now, because this particular department is not headed by me, but I can tell you that broadly India is thoroughly sympathetic, and of course we will be having a very, very rational and objective policy, a balanced approach. And for us, I think this is a time where all of us, you see, India has always believed that the whole world is a family, and we are fighting COVID with the same spirit. So we are not going to differentiate in any way with any particular criteria. This is broadly I can say. Regarding the nitty-gritties, I think the Department of Pharmaceuticals may be able to comment much better. But I promise that if there are any specific concerns on this issue of any particular country, if you let us be aware of those concerns from the Health Ministry, I will certainly pursue them at a personal level and see that all the issues that you raise or that are your genuine concerns, they are addressed adequately with utmost sincerity.
Thank you, Mr. Minister. God bless you and God bless India.
Thank you, Ambassador. Ambassador Renata from TVN.
Yes, good morning. May I begin by, first of all, thanking the India Foundation for organizing this breakfast, extremely valuable to all of us. And let me also begin by expressing the deepest respect and full solidarity of the United Nations system to you yourself, Honorable Minister, to all your health colleagues across the country, and to the entire government. I think, the early actions that your ministry has taken has saved India in many respects, and has bought India some extremely valuable time in which to prepare for this virus. Honorable Minister, I have two questions, if I may. One is, given the size of India and the fact that the virus across such a vast territory will likely have different characteristics at different times, and in different parts of the country there may be different kinds of capacities capable of handling outbreaks of the virus. May I ask, are you considering something along the lines of mobile teams, particularly for areas which might not have as much capacity as other parts of the country? Mobile teams either at the central level or at the state level? And my second question, if I may, is again, this virus has different phases, and we have understood the sort of phase in which we are in now, and the testing that the testing strategy that the government has. But could you explain to us, as we move into the next stage, what would be the testing strategy? And, for example, the serological testing, would that be expanded? If you could give us a little idea of how the testing strategy would be changed as we move into the next phase. Thank you so much.
You see, there are two parts of your question. Regarding the first part, I may tell you that as I had mentioned in my initial comments, that we had issued detailed guidelines about health preparedness to all the states on 17th of January itself. And even before the first case had come, we had been monitoring it almost very, very regularly. And in the initial stages itself, we sent to all the states joint secretary level officers from the government of India to monitor everything. And for every state, we have been helping them on all accounts, including giving them any technical support, manpower support, etc., etc. So right now, because I talk to all the health ministers almost every second, third day and talk to them in great detail, I know that the whole, every state in the country is so well prepared to actually, is there any issue?
There is some problem with your audio, probably.
Is it fine now? Am I audible?
Yes, please go ahead.
So as I mentioned just now that all the states are thoroughly equipped, they are being supported well by the central government, and we talk to them almost every day, and we are ensuring that no state is in fact suffering because of any particular deficit. That part we have taken care of as best as possible. Similarly, you mentioned about Mumbai using some mobile vans, etc. So all the good practices of all the states, also we are trying to in fact facilitate sharing of all these good practices with all the other states. That is also being done. So any good practice which is sometimes some practice may be relevant for some place, other practice may be relevant for other place, but we are ensuring that all the good practices of all the people are being shared with everyone. And then finally about the testing, you said, you see, we have already scaled up our testing criteria, and recently another criteria also we are adding is about all the routine flu cases, etc. We have ramped up our testing facilities numbers. We are going to further improve this number, taking it to more medical colleges now, and very soon this regarding the antibody test. We know that's also one important test which right now to detect the presence of the antibodies IgE and IgM in the serum. So we have already ordered a very significant number of kits, and in all those hot spots where we already have infection to a significant extent, we are to begin with, we are going to have these antibody tests in these clusters where we are already having an effective containment strategy. So there also to see if there is any infection in the community. Although you know with so many tests that we have already done, the number of positives have been just about 3%, although we are already testing all symptomatic cases and all those with travel histories with symptoms, etc., and all those cases of acute respiratory, severe acute respiratory infections, etc. So we are also going to have the antibody tests now in these clusters. And as you mentioned, we are still in the stage 2, and we are working very hard to ensure that the country doesn't enter into a phase of community transmission.
Thank you, Mr. We take one last question. One of the ambassadors has iPhone as the identity. May I request the ambassador to identify and please on.
Thank you.
Yes, go ahead. Well, Ambassador, you are
It's the ambassador of European Union. Minister, thank you very much for your thorough presentation, and thank you very much to the India Foundation for organizing this meeting today. And thank you, Minister, for what you said about global cooperation. Indeed, as the European Union, we believe that global cooperation will be key in overcoming the challenge. I also appreciated what you say about the restrictions on the export of pharmaceuticals, particularly hydroxychloroquine and paracetamol. I think we obviously all agree that domestic supplies must be ensured. And it's also important to keep the global supply chain open and effective. And
and to work in a spirit of global solidarity. So I take from what you said, I understand that it is in this spirit will guide the future decision of the government, and thank you for that. When it comes to global supply chains, can I also ask you what is thinking of the government about the need, for instance, to keep it ordered? That's important, obviously, that distribution networks remain operational while health concerns are probably addressed. So with this, thank you very much, Minister, and best wishes for all your endeavors.
Ram Madhavji, I couldn't follow the second part. In fact, the exact question, could you please tell me the question that he had posed before me? I could understand a bit of it. But...
Minister, you're muted.
Oh. Hello?
Yes, now.
In fact, I could only understand that he was talking about the global supply chain of pharmaceuticals, and he should probably asked about some opening of ports or something. I was not absolutely clear about what actually he wanted me to convey. So, Mr. Ram Madhav, could you please tell me what you could actually understand about his question?
Master, would you like to repeat?
Only the
yes.
Only
just
the
confirmation that the line of the government on hydroxychloroquine and paracetamol will be to address the needs also in a forthcoming spirit. And the second question was about how best to keep global supply chains open, also when it comes to ports, for instance, and transportation, how to make this compatible with health concerns. Thank you.
Okay. I think regarding the hydroxychloroquine, we know that right now hydroxychloroquine and azithromycin, a combination of this has been found to be a good drug combination for treating some of those cases of COVID who have some severe illness, plus also as a you can say safety measure or protective drug for healthcare workers. But we are not we are not going to be very narrow-minded in our approach. Our approach, as I said, is that the whole world is a family, and we will look after the needs of India, and we will also look after the needs of our brothers and sisters all over the world. We are not going to be selfish about that. And of course, we know that without the global chain and all those mechanisms of transportation, whether it is through air or through ports, etc., they all have to be maintained, because unless that chain is maintained, everybody is going to suffer. So we will extend our full cooperation like the rest of the countries of the whole world.
Thank you, Honourable Minister. Thank you, all the excellencies. I'm asked to proceed to another important meeting at 10. So may I request President Through to propose a formal vote of thanks.
Namaskar. I think it's simply remains for me to thank the Honourable Minister for spending his very valuable time for this particular breakfast meeting, especially at a time when the whole world is under a corona threat, and India is also facing the same challenge. Thank you very much, Minister. I also take this opportunity to thank all the excellencies, the ambassadors who have taken their time off, all the members of the diplomatic community, the international community who have come here for taking your time. And may I request you that while we cannot give a formal round of applause, may at least we can thank the Honourable Minister and Minister, whenever we can meet next time from Ram Madhavji, will give a small memento from India Foundation.
No, it's
Namaskar, and all the very best.
It's my privilege, my gratefulness to all the excellencies, and I'm really grateful for giving me this privilege of being with all of you, great people. Thank you so much. Namaste.